It's an important social justice and equity issue. And as a healthcare professional, certainly we want, people that maybe have pulmonary complications, as an example, be speaking to their physicians regarding healthcare decisions like choosing to smoke marijuana. One of the things I'm certainly thinking about too, based on lessons learned, is the impact to mental health. We know from other states there have been acute episodes of psychosis and changes in mood based on ongoing cannabis use. So not only to monitor the outcomes related to particular health issues that people might be using the marijuana for, but also thinking about some of the negative consequences that we've seen from other states and making sure that we monitor that.
Is there any concern with marijuana becoming legal with the concerns with fentanyl use?
They're two very different substances. Fentanyl has been tainting our drug supply chain for quite some time now. So we have a lot more interventions around that, not only test strips to test if your drug supply has been tainted, but, expanding naloxone distribution. So our focus as it relates to fentanyl is on overdose prevention, education around the drug supply.
So what are some of your goals as Health and Human Services Secretary?
First, I want to talk about the Moore-Miller administration's commitment to leave no one behind. Governor Moore ran on that, but he is very much implementing it across all his cabinet to make sure that we are working to build a system that everyone has access to, that we're lowering cost of care, we're increasing quality, we're improving health outcomes, and we're advancing health equity. And that's true of everyone, regardless of where you live. But some of the core areas that, I've been focusing on in the 5+ months I've been in the role is certainly improving our behavioral health system. We are in a behavioral health crisis. COVID has also exacerbated mental health and substance use disorders. And so now we have acute needs, and we're trying to address those acute needs, not only improving our behavioral health system, but building it more like a continuum of care, which exists on the physical side, but doesn't exactly mirror that on the behavioral health side.
Are there any potential health crises that sort of keep you up at night that you worry about?
Oh, there are many things. So certainly behavioral health and the needs of the system. We have ED wait times that are longer than other states, and partly is because we don't have capacity for some of the needs of the people sitting in the ED to move them to the kinds of services that they need, especially in behavioral health. I think about post-COVID, thinking about some communities fared really well and some communities didn't fare as well. So thinking about community resiliency and what did we learn during COVID, and for the communities that didn't fare as well, how do we start focusing on those communities to build the infrastructure that they need or might need for the next emerging infectious disease, if there is one? I'm certainly honored to be in this role and to serve the Moore-Miller administration as well as the state of Maryland. I think there is just lots of opportunity for us to achieve all, the vision that the governor laid out, and, just honored and excited to be part of it.